The hospital is, of course, is undergoing very big changes, and it's continuing, and it will continue. And as you mentioned, the first change, important change, is the change in technology, with the increasing of computer-based technologies, endoscopy, robots, as you mentioned. And all these new technologies are now entering the hospital at many levels. You mentioned the operating rooms, which is true. And of course, a consequence of this is that there is a tendency to be with a longer distance from the patient. This technology is acting as a sort of in between the physicians, the nurses, and the patient, which of course carries some risk, and I think the architects have to take this into consideration. This is why, if the hospital wants to remain a place of humanity, there has to be some balance to balance this hyper technology evolution. And I think to put the accent on the relationship with the patient, with the family, places where they can be met, where there can be a discussion with them in good conditions, in a space where there is some green things, for example. I think it's extremely important. Because this very technological environment, which is the hospital is becoming, there needs to be some continuation. When the patient goes out of the hospital, there needs to be some continuity, and you mentioned telemedicine, which is probably a way to keep some link with the patient in the follow-up of its treatment, for example, in the hospital. So these are two aspects: how to stay in good contact with the patient, while of course bringing in technologies which are of course progresses in efficacy and of treatment, of diagnosis, for example. I think there needs to be a balance between this development of technology, which is a bit cold, a bit creating distances, something which is not easy to understand. There needs to be a balance for the patient and its family through some capacities to establish a relationship, good relationship, contact, and so on. The second aspect I wanted to address is that the hospital looks a strong place because of its high technological development, but in the same time it's quite fragile. It's quite fragile to external events. One of them was the pandemic with an inflow of patients, but you could mention also climatic event, but also sometimes a hostile environment. In many countries now, the question is how to preserve the hospital from attacks, cyber attacks, attacks at the emergency room by people who are not satisfied with the... So how to in the same time preserve the integrity of the hospital and of its functioning, I think is a challenge for the future. As you know, the hospital is mainly, in fact, human resources. Physicians, nurses, assistant nurses, technicians, engineers, and these are, in fact, the main actors in the hospital. And how to preserve this professional population in terms of career, of promotion, of ability to work in good conditions in the hospital, I think it's extremely important for the architects to think about also the quality at work of the professionals. It includes also perhaps discussions about their transportation, their housing. Could they stay in large cities particularly? How can they live not too far from the hospital, not to have 1 hour transportation to go to the hospital and back? These are very important aspects. For example, perhaps by creating some form of housing close to the hospital for young nurses, for example. Well, these are aspects which have to be also considered if the hospital wants to function in a good way. There is also the question of the financial constraints, and it's clear that it's less expensive for the patient to spend a night in a nearby hotel than to spend the night in the hospital when it's not absolutely necessary. So increasingly there is the idea of having a sort of a hotel close to the hospital, housing for some professionals. That's one of the ways for the future. During the pandemic, I think the main lesson was about the flexibility of the hospital, adaptability. Suddenly, hospitals had to adapt to a large inflow of patients. So how to conceive hospitals which can transform some areas to welcome patients with, for example, respiratory distress. That's certainly one of the lessons. Another lesson is also about, as you saw in many countries, the question of access to oxygen. How to make sure that such an important element, which is oxygen, will be accessible to many patients in the hospital. So there are many ways to provide oxygen, but I think this has to be thought in advance. Also, another aspect is the protection of the health professionals with personal protective equipment like face masks. Probably the architects will have to think in the future about a place in the hospital to have a stockpile of masks, so that if there is a brutal event like an epidemic, there can be rapidly good access to these equipments to the health professionals within the hospital. Well, there is also, but it's more technical, the question of the collection of data, because a hospital is also a place where increasingly in terms of public health you need to collect data to inform the health authorities about what's going on. So there is a need to be able to collect these data. Well, these are some examples. One lesson is certainly that the future construction of hospital will have to take into account the need for the capacity to welcome a large number of patients suddenly. But there are also some other solutions, perhaps the transfer of patients in some cases in other cities or other regions, which has been in France used, for example, using special trains, or that's also possibly an option.